Exertional heat illness most commonly occurs when athletes are exercising for a long duration in hot, humid weather, but they can occur in any weather conditions. It is crucial to be able to identify all types of exertional heat illness so athletes can be treated appropriately. When first approaching an athlete that may be experiencing exertional heat illness, you must assess their level of consciousness. If the athlete has collapsed, check airway, breathing, and circulation to rule out a cardiac emergency. If the athlete is conscious and responsive, an athletic trainer should start to talk to them, assessing their signs and symptoms to build a differential diagnosis. Heat exhaustion is often displayed by an athlete's inability to continue to exercise. A patient with heat exhaustion will have a core temperature of 104 degrees Fahrenheit or lower and may display fatigue, syncope, pale skin, dehydration, lightheadedness, and minor cognitive changes such as dizziness, headache, and confusion. Heat stroke is characterized by a core temperature of 105 degrees Fahrenheit or higher, as well as CNS dysfunction. A patient experiencing heat stroke may also present with personality changes, headache, vomiting, hot wet skin, syncope, confusion, irritability, combativeness, dizziness, and staggering, as seen in this video. A patient experiencing any type of heat illness needs to be removed from play and taken to a cool, shaded, or air-conditioned area. In order to narrow down your differentials and come to a diagnosis for a heat illness patient, a rectal temperature must be taken, and the athlete should be closely monitored for CNS dysfunction and cognitive changes. Rectal thermometry is considered the gold standard in assessing an athlete's core temperature. To obtain this measure, once the patient has been moved to a cool area, they should be placed in a side-lying position with their top hip and knee bent and draped with towels for as much privacy as possible. The athletic trainer should put on gloves, clean the thermistor probe with isopropyl alcohol, and lubricate the probe. After turning the thermometer on, the probe should be inserted 4 inches past the anal sphincter. The athletic trainer should pre-measure and mark this 4-inch line on the probe ahead of time, as shown here. The probe should be taped to the athlete's skin and left in for the duration of the treatment so core temperature can be continuously monitored. A temperature of 104 degrees Fahrenheit or less with no CNS dysfunction is considered to be heat exhaustion, while a temperature of 105 or higher with additional CNS dysfunction is diagnosed as heat stroke. Cold water immersion is the most effective and best way to treat an athlete experiencing exertional heat stroke. This can be done with the TARP taco method or with a cold water immersion tub. The taco method is shown here. The athlete should be laid on a tarp, and all excess clothing, equipment, and shoes should be removed as appropriate. Place a towel underneath the patient's arms and pull up so their head and neck can be held up and supported. Other rescuers will come and hold up the edges of the tarp while someone continuously pours ice and cold water over the patient. Rescuers around the edges of the tarp should shake the tarp continuously to circulate the cold water over the athlete. To complete cold water immersion in a tub, the athlete should again be removed of their excess clothing, equipment, and shoes with a support towel placed beneath their arms to prevent the potential for drowning. The tub should be filled with ice water and stirred continuously. Both methods of cold water immersion must be continued until the patient's core temperature is reduced to 102 degrees Fahrenheit, and only then can the patient be rapidly transported to the nearest emergency department for further monitoring, evaluation, and treatment. It is the goal of cold water immersion to lower the core body temperature to 102 degrees Fahrenheit within 30 minutes of the athlete's collapse. Proper cold water immersion should cool the patient by about 1 degree Fahrenheit every 3 minutes. Death by heat stroke is 100% preventable if staff are able to recognize and treat the condition early, appropriately, and in a timely manner.